Hey everyone, pharmacist Patrick Alonso back again with Blue Zone Healthcare Advocates here on YouTube. And today I'm going to talk about why having a pharmacist as part of your healthcare team is absolutely advantageous to your healthcare, especially if you're on polypharmacy. So that means more than three or so medications, up to five or more. Polypharmacy is something that plagues many, many Americans. And there have been some statistics that even show that 50% of hospitalizations of people over the age of 65 are attributed to polypharmacy, which means more than really generally five medications. Americans across the globe are the most prescribed individuals in the world. So polypharmacy gets a lot of Americans, and frankly, medications are a great tool. I love telling my clients that medications are a tool for you to use to get healthy. Now, medications are not the solution because if you were healthy, you wouldn't be taking the medications for your whole life. Now, some people, they need medications for the rest of their life. Some people need medication just for a short period of time. My goal is to find out what you need as the patient by listening and caring. And then what I do is help tailor fit a plan where we can either get you off the medication eventually do through lifestyle change, appropriate testing, procedures, or get you to the lowest effective dose of that medication. When we start taking medications and the dosage is too high, a lot of times that's where people start really experiencing side effects. That also puts you at risk for medication errors, and it also puts you at risk for medication interactions with other medications. So sometimes two meds that might interact at a lower dose might not really have too bad of an implication. But when you start going with higher doses of medications together that maybe shouldn't be prescribed together or do have interactions, you're much more likely to see that interaction in an individual, whereas your body would be metabolizing most of the smaller doses of medications out. So I'm here today to educate everyone on why a pharmacist-led healthcare advocate team is the best way to go. Hands down, I'm advocating for my profession, and you might say, well, Pat, you're a pharmacist, so you're biased. But there is no other profession in healthcare that understands medications like pharmacists. And that goes back to our education. So I'll give you a perfect example. A pharmacist gets at minimum in school 4 years of education on drugs. I mean, this is really our bread and butter. Now, the other professions, so you're looking at an MD, Dr. DO, a PA, a nurse, they do get education on medications without a doubt, but it is considerably less than what we get. And so pharmacists understand the interactions much more intimately, and we understand the purpose of these medications, the mechanisms of action, and we understand all of the medications in a class. So the very unique characteristics of certain medications we understand. And so I think that that is what sets a pharmacist apart from any other healthcare field or healthcare position that could be an advocate, which any healthcare practitioner really could be an advocate. If you're a doctor or nurse and you're watching this video, you understand the healthcare system, you get it. But I'm advocating for us understanding the medications, being able to get our patients on the right doses, and being able to titrate those medications up appropriately so that our patients are on the lowest effective dose of medication while also still feeling the effects and getting the positive benefit, mitigating the side effects and other interactions with medications. Another reason a pharmacist is a great resource for being a healthcare advocate is because we understand the pharmacy. And as many of you might know, if you're on multiple medications or have a family member that's on multiple medications, you know drugs are expensive and they're only getting more expensive. I believe recently I saw that a lot of the PBMs, which is a whole nother video, and other big pharmacies are actually going to be raising the cost of medications by 900% for certain medications. And when you're talking about senior citizens or the older population, a lot of them are on a fixed income. And so, how is that fair to have people that are elderly, already sick, already frustrated, and already tired now have to fork over more money in order to get the care that they need or the medications that they need. Now, there are plenty of ways to kind of mitigate these issues or at least help with reducing the cost of medications like coupon cards. But if you're on Medicare or TRICARE or another government funded program, you can't use the coupon cards. Sometimes you can use GoodRx or an equivalent program, but again, not always great for Medicare patients. You can order 90-day supplies, right? That does, and at times lower your medication burden. So there's some different ways to kind of deal with the cost of medication. Generally, a lot of times you're always going to have to pay a little bit of something, but saving money on the medications really kind of helps people feel better instead of going to the pharmacy and knowing, hey, I've got to fork over $1,000, $1,500 for my meds this month. When you think about that, if you pay $1,000 a month in medication, that's $12,000 a year. That's $12,000 a year that you are essentially putting into medications. Some of them you may not need. And so it's my goal as a pharmacist to assess the need of those medications and to determine if there might be a cheaper or better option out there, something that aligns more with your formulary for your insurance, or something that you might even be able to cash pay and get cheaper. Believe it or not, you can cash pay some medications and get them cheaper than what you would with a copay. So another way that a pharmacist is a great advocate for someone in the healthcare system is that we understand, generally a lot of times we can look at your medications and we can know what disease states you're dealing with. We also know what tests. So this is something that was put very highly in my education, is what tests to get for certain diseases. What are the gold standard tests that you need? Now, I've had it in my own personal experience as a healthcare advocate where me and a client walk into a doctor's office. The doctor runs some tests in the office and says, and we have a discussion about, okay, what further testing do we need to do? And we have the discussion that a certain scan or a certain test is the gold standard for this patient and will help diagnose their disease or potential disease properly. And the doctor actually, they run their test in the office and they say, well, in my professional opinion, you have XYZ. And you watch the patient feel now outcast and upset because now they've been diagnosed with a disease or they feel like they've been diagnosed with a disease. But you have to ask as an advocate, why are you saying this when we haven't done all the proper testing routes? And so actually in this very same scenario, my client and I went through the proper avenues of testing and they didn't have the disease that the doctor thought they did. It actually ended up being another issue. Now imagine if that patient would have started taking the medication for that disease and we find out later down the road that they were completely misdiagnosed. So I feel like it's important as an advocate to be able to run people through all of the testing possible so that they can get an accurate diagnosis and so that treatment can be targeted for the disease rather than just throwing things at the wall and seeing what sticks. Another reason I feel like pharmacists are very great healthcare advocates is because we're very respected in the healthcare field. I know from my personal experience in practice before I started this business that providers would ask our opinion about different insulin dosages and different drug medication dosages, et cetera. And generally, your providers really care about the pharmacist's opinion. And if you know about hospital pharmacy or about how hospital medicine works, a lot of medications are run through the pharmacist first and before they even get to the patient, just to make sure there's no interactions and no issues. And this is so important because you're going to limit adverse drug reactions to your patients by understanding that these medications are what should be on board. And we can coordinate and provide comprehensive care, continuous monitoring, and educate our patients on all the things that a lot of providers just don't have time to do. And I'm not knocking them. I'm not, saying this is bad. There are some awesome doctors out there and I work with them daily. But the problem is they're limited by how much time they can spend with the patient through the insurance system. Now, I'm your concierge. I'm cash pay for my time and for my knowledge and effort, but it's worth it if you just have a couple hours of my time, if I can clear up some answers, if I can show you how to do the right test. So let's say, for example, glucose monitoring. If I can show you how to test your blood sugar appropriately, you're not wasting money on strips, you're not, you know, wasting money on devices. You're doing it right. You're doing it right the first time. You're recording it appropriately, and you're able to monitor things yourself. And so my goal is to teach you how to monitor these things so that you can become self-sufficient in the healthcare system. And I just keep working on getting you healthier, keeping your information organized, and making sure that your drug and medication regimens are appropriate. And finally, I think pharmacists are really great because we understand insurance. We've worked behind the counter at the CVS's and the Walgreens, and we understand how the insurance model works. We understand when you're going to get billed more, and we understand what questions to ask the insurance company so that you're not getting billed for things inappropriately. We can look at an insurance bill and we can say, well, you weren't provided this service, and we can protest that so that we're keeping money in your pocket and not throwing it away on services that you didn't need or receive. So to close out this video, again, my name is Patrick. I'm a pharmacist, and I'm happy to be your healthcare advocate, whether it be on YouTube, whether it be in person, in real life, or virtually. Please don't hesitate to reach out. Patrick@tampahealthadvocate.com is my email, and my website is tampahealthadvocate.com. Please like, subscribe, and share this video with anyone who might need help advocating for themselves in the healthcare system. Or if you just have more questions about the healthcare system, I'm happy to answer them. My goal is for everyone to understand the system appropriately so that they can make the best choices for themselves, not let an insurance company or someone else dictate what's right for you. Only you know what's right for you, and I'm here to help you get to those answers. Thanks, guys.